Hi, my name's Paige Kreitz, and I'm an ICU nurse in Columbia, Missouri. I wanted to kick off this channel to help educate the public, share some nursing anecdotes, support other nurses, and I just thought it was a kind of a fun idea and something to do with my extra time. Not that I have a lot of extra time, but I thought this is something that I can do that can benefit a whole lot of people. So I kicked off the channel months ago, and then I just didn't make any videos. So I made a poem about a week ago. It took me about an hour to make it, to share my feelings about what happens in the ICU, and just to give the public a general glimpse of what nurses do. Sometimes I feel like people don't really know what nurses do. They don't, not that they don't appreciate what we do, but they just don't understand what we do, so they sometimes fall short of really comprehending the magnitude of what happens in that ICU room with their loved one. And right now, in the midst of the second wave, the second surge of the COVID pandemic, the understanding is even worse, and it's compounded with frustration because family members are not allowed to be with their loved ones in the ICU, and so they are limited to just calling, sometimes once a day, if they get a hold of that nurse, and they get frustrated. And the nurses get frustrated because sometimes there's just a lot of calls, and the nurse feels bad. She can't come to the phone every time, but she's really busy. And so this poem is just a way for me to express myself, and then I decided to post it on Facebook, and it just kind of blew up. So I thought, man, this is a good opportunity to make this as the first video for my channel. So I'll go ahead and read it. It's called A Nurse's Perspective on COVID by Paige Kreitz. I've been an ICU nurse for 25 years, seen a lot of death, seen a lot of healing. There's a pattern of sickness and wellness. We know what to do, and we do it well. In the ICU, some thrive, some merely survive, some die. But there's an ebb and flow to this. It's predictable. This disease, however, is different. It's like an enemy that has no shape, no predictability. Some are merely inconvenienced by it. Some die from it. Those who die often die alone. I hold the hand of a lady whose husband couldn't drive fast enough to be with her in her last moments. I'm sometimes too busy to talk to a patient's family because I'm trying my best to keep their loved one alive. I see the blank look on the faces of those who've been taken captive by it. I'm there with them when their own families cannot be. I am with you. I'll protect the breathing tube, which helps to ventilate you. I will suction your lungs. I will monitor your ventilator settings to make sure you get enough oxygen. I'll clean inside and outside your mouth. Keep it moist so that your tongue doesn't and lips don't crack and bleed. You're laying there helpless, but you're really not alone. I am with you. I'll clean you when you have a bowel movement. I'll approach the doctors about maybe changing your feeding formula if it causes diarrhea. You'll stay clean and dry. You're laying there helpless, but you're really not alone. I am with you. You may have 5 different continuous IV medications keeping you alive. I'll monitor and change each one if needed, if I see you're not doing well. You didn't even know I'm there, but I'm doing my best to help you see your loved one, see your family again. You're laying there helpless, but you're really not alone. I am with you. I will turn your body side to side so that you don't get bed sores. I will assess your skin often because the swelling in your body causes fluid to leak out of your pores. Your skin becomes thin and opens easily. I'll be gentle in handling your body so that you don't get skin tears. You're laying there helpless, but you're really not alone. I am with you. Whatever problem comes up, our team will handle it. I am the doctor's hands, and I spend the most time with you. Out of any other person in the hospital, you see me the most. But even when we've done all we can, and if, despite our best efforts, you are still dying and laying there helpless, you will not die alone, because I will be with you. You know what a nurse does in the ICU, you can't capture everything in a poem. Every detail, all the responsibilities, all of the moving parts that happen when taking care of an ICU patient, because it's not just about the nurse taking care of them, it's the respiratory therapist. They have a huge role in taking care of a patient, because the ventilator, the respiratory therapist troubleshoots the ventilator, sets the settings in place that the physician has ordered, maintains the ventilator. Just the ventilator itself is just it's complex, and it's obviously life-saving, but you need an entire team of people who know how to manage a ventilator when you have an ICU patient, when you have ICU patients, when you have an ICU in your hospital. So the respiratory therapists are amazing. They help. When a nurse sees that the patient's oxygen is dropping, and she herself has done what she can, maybe suction the patient, turn the patient, temporarily increasing the oxygen delivery on the ventilator, and the patient is still dropping their saturations, we call the respiratory therapist, we call them stats to the room, because you can't live without oxygen. So very thankful for them. We also have housekeepers. They're so important too. They come in, they clean our rooms, they sweep the floors, and you wouldn't believe how messy, trashy an ICU room can get if someone was not constantly cleaning. It's like a trash can. It can look like a trash can, because we're opening packages, we drop things, and we're certainly not going to reach down to the floor and touch things that have touched the floor with our gloves. No, we're going to keep our hands busy, clean. So, most of us do pick up things on the way out the room, but not all of us. So housekeeping is so important, especially for wiping down the counters in the room, and just maintaining cleanness in the room, because the ICU nurses, they're busy taking care of the patient. Then there's our secretary up front, who receives the phone call. She kind of when a nurse tells the secretary, hey, I can't take a lot of phone calls today, then she will, I'm not sure, I don't remember what the word is, she'll field the phone calls. Well, fortunately, in our ICU, we have when we admit a COVID patient who can't have family members come visit, and by the way, no one in the hospital can right now. Family members are not allowed unless the person is actively dying or is on hospice. And in my poem comes from the perspective of taking care of a patient who wasn't dying at the beginning of the shift, but died quickly, despite all that we could do, and their family member. This happens sometimes. Family members can't get there fast enough. See, in our ICU, our hospital, it serves many, many counties around it. It's a community hospital, 400 plus bed hospital. And so many of our COVID patients are not residents of our town. They are brought in from other hospitals who cannot manage those very sick patients. And that is our mission. That is what we do. That is what we want to do. We are a community hospital. We serve our community right around us. We serve the counties around us. And consequently, we have COVID patients. And we always have patients in our hospital who are brought in for even other reasons. Normally, any other reason why a patient would have to be in ICU. But specifically talking about COVID patients, just from the natural way of things, many of our COVID patients are not residents of our town. So consequently, their families sometimes are an hour away, 2 hours away, 3 hours away. Not 3 hours away often, because there are other hospitals besides ours. But the problem is, when a patient is doing okay, and then they just suddenly deteriorate, we call the family. We update them, your family's not doing well, but at that point, we don't think they're going to die. We're doing everything we can. But then they just decline so fast. So fast. And then we call the family and say, I don't really know, it's so personal with each conversation, how to tell a family member that their loved one is dying. This is a physician who does this. But basically called the family and said, you need to get here right away. And the family, of course, I'm sure, drops everything to come. But they sometimes don't get here in time. So what happens? The patient is alone. And so I've been in that position. I've been in that situation, and it's tough. It's so sad, so sad. So the ICU nurses are the ones who are with that patient. That one patient who this scenario has played out again and again. Not all the time. And not all of our ICU patients are dying. I don't want to paint some morbid picture. The hospital is just some large death facility. It's not. There's many patients who do well. There's many COVID patients, people who have COVID who don't step foot in the ER or the hospital. But some of these poor people, they die alone. They die alone. And it is so sad. And so what I do when I see that their family's not going to make it is every spare minute I go in and I spend time with that person. I talk to them. Many times they're not, they don't appear to be cognizant, but I always assume that my patient can hear me. So I talk to them. I tell them, it's going to be okay. Your family's trying their best to get here. I'm here with you. I hold their hand. If I feel it's appropriate, I'll pray with them. And I myself am very good at compartmentalizing. Maybe that's why I can be a nurse around these very horrible situations and not collapse in a heap in a ball of tears. But I can go to work and I can take care of this patient. It still bothers me, but it doesn't break me down. It does bother me a lot, and sometimes I do have to decompress and practice self-care and all of those mental health things that we all should be doing for ourselves. Well, nurses really need it right now because although I can compartmentalize, not everybody can. And nurses who work in the ICU and who are in this kind of situation, they need support from home and from the community. And I don't know what the solution is, and I'm not gonna address the whole mask thing. That's been beat down. If someone isn't wearing their mask, I just don't know what else can be done to educate them. But as far as nurses and what they do, and this is probably, respiratory therapists and housekeepers and the secretaries who work in the hospital who see these situations play out. They need support, and we get hangry sometimes. You know, food helps, but it's not the only thing. Thank yous and a show of appreciation is really nice to see. So, okay, I think that's good. That's a good amount of time. I will make more videos as time allows. We're all going to get through this together. It's going to be okay. It's going to be alright. Thanks.